Welcome. Thanks. Thank you, everybody. We're really happy to be here, taking part in this summit here today. I think it's really special and exciting that we've just got the healthcare industry here. So many unique challenges and things that healthcare professionals have to deal with day to day that are front and center, that I do think weave through other organizations as well, but sometimes get buried, whereas in the healthcare system, they have to be front and center because you're taking care of patients every day. So very excited to be here today. So Naomi Bradley, I'm a managing director at Deloitte. We were talking a little bit earlier about longevity and loyalty to organizations. Both Mike and I have been with Deloitte for quite some time. I celebrated 25 years last year, so I've spent a lot of time just working with clients in the employee experience, rewards, recognition, well-being space. I would say over the last, 5-7 years ago, it's really expanded into that just overall employee experience, and how does an individual really get the most out of working for their organization, and how does the employer really help foster that experience and that relationship? So very excited to be here to talk to you today. I'll let Mike introduce himself as well.
Awesome, thank you. What's been really fun is Naomi and I have had the opportunity, you said it, to work together for me, 19 years at Deloitte, and similarly had the opportunity to just figure out ways to help my clients take care of the people that take care of their business objectives, and trying to foster the most unique relationship humanly possible between the workforce and that organization. I want to spend a moment, if it's okay, just talking a little bit about the Alliance before we talk about content, because I think that's really important, and acknowledging what Deloitte and Awardco do together. So first had an opportunity to meet Steve in 2017, but then fast forward to 2020, had an opportunity to spend time with Steve and Judd Tolman and learn a lot about Awardco. And you started seeing some really recognizable themes, the recognize the good, the idea of taking care of people, while at the same time, Deloitte's leadership in our human capital space was saying, we want to make work better for humans and humans better for work, right? The idea of taking care of people resonated across both organizations. And so from early conversations, we began to identify, how do we mutually support clients that are truly investing in the relationships that they're fostering with their workforce? And those conversations proceeded. In 2022, we realized for the first time there was a unique gap that Deloitte and Awardco could solve together, which is to understand that compliance and regulatory management of recognition and the tax elements there was a unique part that wasn't being addressed by the ecosystem of recognition providers. And so Annie Bearden, a Deloitte colleague who's here in the room, Sandy Shuren, another Deloitte colleague, partnered with Awardco, fostered an alliance, and now and for those that are using the platform, you'll see a solution in there for employers to understand and acknowledge how to manage the tax compliance regulations that exist for delivering these programs. We then fast forwarded again and acknowledged there are continued opportunities for the two organizations to help take care of the employee population. And that's manifested itself into an extension of that alliance where Deloitte's human capital and tax teams come together with Awardco in supporting our clients, in finding ways to maximize budgets, and finding ways to identify cost savings, finding ways to think about cost reallocation, ways that we know we can support the clients in their journey in taking care of their people and allowing the people in the organization to recognize the good that everyone is doing for each other. So Naomi and I got together with the Awardco team, and we said we wanted to talk about ways that you can think about how to allocate or reallocate some of your spending right now, and optimizing that spend to find ways of taking care of your people. And so we're going to talk a little bit about that. We're going to talk about some use cases as well. Projects that we have done alongside of our clients who came to us, acknowledged some of the budgetary challenges that they were facing, and asking for solutions and working collaboratively with us to find ways to create budget, to reallocate, to support the total rewards experience of their workforce in new or unique and different ways. So I'm going to spend the time doing that. Want this to be open and collaborative. And so as we're going through use cases, stop us. If you have a question, you want to understand a little bit more about how that happened, by all means, we're here to support that type of conversation. Else, Annie, Naomi, myself, there's a room that Awardco has set up. If anybody wants to deep dive into one of those topics or anything else that's on your mind, please come find us. We're happy to support that conversation.
Wonderful. Yeah, we'll set it up with a slide or two here, but then I feel like this is kind of an extension of the panel conversation that we had earlier, just more of us representing some of the conversations and projects we've worked on with our clients. But as Mike said, would love to have people chime in on things that resonate and have a more interactive conversation if we can, knowing that we're standing between everybody and lunch, which is never the enviable spot here. We developed the topic for the conversation today, right? Because I feel like healthcare organizations are really at the center of the perfect storm, right? Tons of industries right now are trying to figure out what's the new normal after coming out of the pandemic and everything settling down, and the new voice that the workforce has found to be very vocal about what they want and what they need and what they expect. And there's cost pressures on other industries as well, but not necessarily the margin constraints that you all are focused with in the healthcare space, which makes it very challenging to act on some of the things that you're trying to do. So some of the challenges, right, that you're faced with, right, the workforce shortages, there's the continued aging population need for care, and it feels like fewer and fewer skilled technicians, nurses, clinical staff, professionals out there to draw from as we're trying to make sure that we're meeting the needs and the demands. And the labor costs continue to trend upward. So the amount of things that you need to do in order to attract and retain the right talent to your organization requires you to be creative and really thinking of what you can do outside of purely increasing compensation or increasing benefits, right? Ways to reallocate costs, creative ways through some of the things that we talked about earlier, right? Through recognition how important it is to just give thanks and recognize teams and things that don't cost money, but figuring out what about those things is going to resonate with your workforce to really make that difference. The cost of healthcare itself is increasing, right? And there's a lot of pressure on organizations to make sure that the services that you're providing are remaining affordable while still managing to run your business, which you do have to run as a business as well, right? So again, that sort of perfect storm. We heard some from a speaker earlier today on AI, right? That is going to continue to disrupt while revolutionizing, right? There's a lot of great new ways that AI can come in and make things better, but it's disruptive, it costs money, it distracts from other things that are going on that you don't have time to take a distraction from. So that's something that you're dealing with as well. And it's come up a couple times around mental health, right? Behavioral health. There's such a need. Just in all aspects of life, in all different generations, for that support from a mental health capacity. And a lot of organizations currently are not set up to handle the volume that's needed in that space. So a lot of challenges that are putting pressure on creating that employee experience, finding the workforce that you need. Some of the things that we're working with our clients on is really coming up with a central either team or person or way of making some of these big transitions in a holistic manner. So thinking about things from a clinical perspective, from an operational perspective. How are we going to pull it all together and not be working in silos within our organization? And when we're thinking about that transition office, we can think about it in a few different ways. There can be aspects from an operational perspective and really figuring out how to make the caregiver experience something that is sustainable. How can we make the experience experience right for both the patients as well as the caregivers. And then also think about it from a process perspective, right? Are there, when we take that deep dive into the current state, are there gaps that we find? Are there ways to streamline things? Are there things to do that could potentially, find savings, create efficiencies that could free us up to do other things? Probably nothing all that new there, the challenges that you are dealing with day to day, but we feel like it really sets the stage to what you need to be handling as you think about how to handle the workforce.
And maybe before we switch, if we could just switch back, right? Because, I would imagine folks are looking up at slides like this, and I think we've seen it throughout the course of the day, right? And so workforce shortages, how are we going to do that? Do we throw more money at it? Do we even have more money to throw at it? Increase healthcare costs. All of these things, like you hear cost and then you say, how and where are we going to find margin in order to make these things, these challenges, turn themselves into opportunities? And I think that's sort of what we wanted to just spend some time with talking today. So if we look at maybe this next slide, we know that what 9 times out of 10 happens across most of our clients is if there's margin challenges, somebody's going to say, we're going to address those margin challenges in our total reward space. Quite frankly, it's going to be the biggest line item at the bottom of every organization's balance sheet. And without care or concern being placed beforehand, someone will say, if we can simply trim 2%, if we can trim 3%, then we're going to be fine. But for those in the room that think about that mission of recognizing the good, of making work better for the humans, you will fundamentally realize that in doing that, if you simply adhere to a policy of chopping arbitrarily from the reward spend, it's going to impact the experience. And so how can you do it? Or what's the thought pattern that you should be considering as you recognize margin challenges, but also recognizing the operational, the people challenges that we talked about on the previous slide? I'll point out to the 2 questions that, as you contemplate this in your own organizations, the things that are important to think about. So what's the time frame? Right? For most of our clients that come to us and want to talk about how and where, Deloitte, have you seen X? Or how and where, based on what you know of our business operations, could we achieve Y? First things that we'll tell our clients is, what's the time parameter? How quickly, how succinctly, how deliberately are you going to need to consider some of these changes? And what's the appetite to redesign? With that construct, look at the bottom right-hand corner of this slide for just a moment. The idea of if you need to do something in less than 6 months, minimal change, the idea of just simply containing costs. Look at it from a bottom line perspective and say, how and where can we find some of these opportunities? And in the slides that come, we're going to talk about some organizations that needed to do that, needed to move really quickly to find and reallocate costs. Going all the way to the top, to reimagine, to truly think about things from a different perspective, to utilize it. I think some of the folks that have been up here have talked about workforce sensing from Children's Nebraska. The idea of any change that you know that's going to impact the lives of your workforce needs to be done with their voice in mind. So taking that human-centric lens and applying it and being deliberate about the way that you apply it is going to be really important. So with that said, maybe we can just start jumping into some of the use cases, the things that we wanted to show you, where we've seen some of this happen in what we're calling in real life.
Exactly.
Okay, so setting the stage and helping the group understand, I'm going to explain the situation that our client was in, the solution that they looked at. Now, every one of these solutions was tailored towards the audience. It was tailored through deliberate conversation and deliberate planning. And then the impact that had. So with our first one, this was really about trying to become an employer of choice, right? And we've seen from some of the earlier presenters, it's hard to find talent. It's hard to continue to engage talent. It's hard to continue to motivate talent. This organization looking at it and saying, we want to do all of those things. We want to be the employer of choice. And we know that we can do that in the ways that we take care of our people. However, we need to be cost neutral. So we can't, throw more money here and throw more money here, throw more money here. We need to be really deliberate in the manner in which we are investing in our talent and look to do so from a cost neutral perspective. The solution, and I know, again, it's come up, and I'm going to take a quick pause moment, Naomi. This client used conjoint-based methodology, max diff, folks know it. But if you're not familiar with conjoint, right, if it's not something that's something that you've done in your organization, let me just explain it. It's essentially, rather than your traditional Likert scale questions of tell us how you feel 1 through 5. The result of Likert is important. It gets you linear data year over year over year so that you know in aggregate how your population's feeling, but it doesn't provide the why. Conjoint allows you to consider what does the why look like? Because rather than asking you to force rank something 1 through 5, it says force rank this thing compared to all of the other things within this survey. Tell us what is your biggest concern out of this list. Tell us what's your least concern. And presenting the questions in such a way that through repetition of the question, but with different options to choose from, you begin to learn what is truly important to your organizational people, right? You begin to know what are their needs, what are their concerns, what would they be willing to trade off to get more? That's what conjoint allows you to do. It was a marketing tool for many, many years.
Right.
And we're starting to see it a lot more in the benefit space.
Yeah, and it gives you really actionable data, right? Because if you have the 1 to 5 scale, everyone's going to want like more for retirement, and I want more PTO, and I want more healthcare benefits. Well, you don't have more money, as Mike said, to throw at everything, right? So it gives you really targeted, clear data when people have to make choices in the same way that leadership has to make choices about where to spend, and you can see, where your workforce is going to make those choices, and it helps not only in making those decisions and taking the action, but also in the communications and the change management to your employees, right? Bringing them along the journey, telling them this is why we're doing it. We're asking you these questions because we have to make choices. We want your input into doing it. And here's how we're going to then take that input and make changes that are going to be really meaningful for you.
Yeah, absolutely. So for this organization, they started with asking, like, what's your everyday needs and concerns? What's the things that keep you up at night? What's the things that challenge you, challenge your family? What makes life tough, right? Simple questions, choice list. What they learned from that is workload management, which I'm imagining to most folks in the room, right? You acknowledge that. You know your workforce, and you know that your workforce over the last few years has been fundamentally challenged in ways that they haven't been challenged before. Some of the stats that Naomi talked about on the first slide. Aging population, which means greater need from a healthcare perspective. The availability of healthcare professionals to tend to all of those raising needs. Workforce management for this client, I'm sure for many others, is always going to resonate at the top of that list. And then for this client, it was also medical illness prevention. Possibly influenced a little bit. This was a post-COVID study that was done with this organization, but still alive and well, right? And probably more so in the healthcare industry, where people just realize their day-to-day interaction with folks that require medical care and wanting to make sure they're taking care of themselves physically. With these concerns in mind, we started testing out, like, okay, well, what about programmatic changes? If this is a concern, what do you think about this? And would the availability of this over other things, would that make things better? Would it make things worse? And then what would be, from the analysis perspective, the cost of doing that to the organization? So acknowledging where there are opportunities to enhance the experience, but also acknowledging places where you need to create the trade-offs in order to make it all digestible. Again, to this client, looking at things from a cost-neutral perspective. Let's go down to the impact. Right? And so what this client found at the end is that the way to acknowledge, the way to provide the best workforce experience to address the needs and the concerns that their workforce came back and vocally shared through the surveys was the idea of just more family leave benefits, the idea of needing to be able to step away from work as those needs arose. The organization's ability then to shuffle around the work, to think about shifts in a fundamentally different way, to allow for family leave. Fertility coverage was another area, interestingly, for this particular organization, that by enhancing that particular benefit, they recognized that they could create something that was differentiated in their local market, and they wanted to double down there. Dental coverage, all things that you would look at day to day and ask yourself, does this really change the employee experience, right? And did I read the latest benchmarking study on something? And what this client learned, what many clients learn, is that the information from a benchmark, really good for conversation, but fundamentally changing, simply required asking employees and just creating nuanced changes in their offering at a cost-neutral perspective. So here, they funded it by just adjusting some of their medical insurance costs. The employees acknowledged and said, we are willing to do X if it gets us Y. And walking away with a different program, communicated succinctly, communicated clearly, actively brought to the workforce to say, this is what you told us, and this is what we're doing about it, and this is when it's going to be in place, and this is how you utilize these types of benefits. So a great experience, one where this organization, through this analysis, can and will become a differentiated employer in local market by responding to the needs of their employees. Yes?
So when you talk about budget neutral, you're referring to budget neutral for the employer.
Correct.
But perhaps not the employee in this case.
Or it's how and where they're spending their money when it comes down to making some of their open enrollment election. That's the most unique microphone I've ever seen.
I was wondering what that was that you were holding.
So you can throw it.
I'll throw it.
All right.
Throwing that's the most fun.
Nice.
Yeah.
But I mean, the idea was to look at costs in aggregate for both employer and employee and determine how and where you would reallocate based on what those employees came back and said they would be willing to do or receive less of to get more of something else.
Yeah, it's sort of a value equation.
It's 100%. It's just, it's not decisions made in a room by people who say, I know my people and I know my people want X. Yeah. It's simply going out to the workforce and saying, how can we take care of you better? And to be able to do that, we want your input. We need to know where you're being challenged so we can think about what do we do either from a total rewards perspective or otherwise. I think not on this specific case, but a lot of our clients will take this information and they'll bring it to other areas of the organization just to say there's human emotion connected to this feedback. Let's use it beneficially for all.
Right, and Mike glossed over it a little bit, but we typically do these analysis in two parts. And the first part, where we measure that unmet needs or the challenges or what keeps employees up at night, just gives a lot of fundamental data around what are your employees struggling with and thinking about. And we take that data not only to inform the second survey, where we're really able to optimize the cost and the preferences, but a lot of that data also, like I said, can inform communications, can inform other areas of the business. It gives you a really tremendous insight into just what your employees are dealing with day to day and how to help them. And some of it can, have a cost associated with it, or can be in the reward space, and some of it can just be related to career path or related to recognition or some of the areas that you can handle in different ways.
Excellent. We'll jump to the next one. So programmatic changes. This was a client example, maybe doesn't resonate a lot, but wanted to share this one. This was one where it was a system, but operated largely independent, right? That there was multiple hospitals, all connected, but doing things independently, again, from a benefits perspective. And realizing that this organization wasn't taking advantage of harmonizing, right? Taking advantage of the scale that they could represent because of the legacy thinking of, no, this is mine. I've created this thing and my people like this, and so I don't want to change or adapt. We brought all of that together. We talked to this client and acknowledged you have duplicity of benefit vendors, providers. You're not getting the maximum utilization of these benefits. You're creating confusion from a communications perspective, an adoption perspective. We are not taking advantage of scale in a way that really makes sense. And so we also learned just general dissatisfaction, right? Somebody would be getting a benefit in this part of the organization and find out a friend that they've made in a different part of the organization was getting a different type of benefit. It looked appealing. All of the sudden, you've got talent moving at the detriment of one part of the organization for the other, right? And so for this client, they came through and said, we can no longer operate like this. It is just fundamentally bad business. So we know that we've got relationships across all of these brokers and all of these vendors, and we've got this various benefit design. Help us figure out how to centralize it. Help us figure out what's the right thing to do for our workforce in a way that's fair and equitable, in a way that allows the organization to deliver the right experience, but to do so effectively, top down, out to the rest of the workforce. You'll see at the bottom, and I'm sort of mindful of some of the time because we got some other great examples.
Yeah, that's okay, we're doing all right.
Okay, the impact. Nearly 10% of unnecessary cost was removed from this relationship. And you know, for those that understand the magnitude of cost from a rewards perspective, that's a lot of money. And then they're able to reinvest those savings back into places that create a better experience. And it wasn't to this organization before we began working with them, they didn't necessarily think anything was wrong, right? We operate as a business here, and we do this here, and we do this here, and we do this here. It's not wrong. They just weren't thinking about the way to drive a little bit better efficiency, and that from that efficiency, how that cost savings could be used and reallocated back into the business, created better operations, created, and you can see, a better talent and mobility experience. Folks weren't leaving one job at one place to go for another because of a particular benefit. They were navigating their careers in a much more educated manner, knowing that any decisions that they made weren't going to be advantageous or not from a benefits perspective.
All right, typically, we often like to look at rewards in totality, but we have a couple examples more specifically on compensation. And this particular health system was really struggling with attracting and retaining, specifically their nurses, but some of their other populations as well. And they came to us and said, we really need to figure out how we can make sure that we're providing the right level of base pay, to our folks. However, it needs to be cost neutral. So you need to help us figure out, how to look at our compensation philosophy and pay policies overall. And so what we did was really, dig into some of the special types of pay. We were thinking about, premium pay and overtime and holiday and some of the programs. And similar to what Mike was talking about in the previous example, this was a large health system made up of a couple of different legacy hospitals, and there were some different practices across the legacy organizations. And so we helped to evaluate those policies, harmonize them, and really be able to take some of the cost savings that we identified in some of the special pay policies and able to free up some money to make some changes from a base pay perspective, which was more in line with market, and really help them just to be more, be able to pay where they wanted to be able to continue to retain their staff. And it was interesting because they didn't come to us initially and say, it's our special pay practices that we need to review. It was more like, let's focus on base pay. And as we dug in, there was a lot of things that they were doing that could be cleaned up and standardized and even become more transparent for the employees across the organization to make a better experience overall. So a lot of great value was provided to this organization through this project that we worked on together. All right, let's see how we're doing. We're doing great. So another project, this was one that I actually worked on recently, another large healthcare system. This one, we were also helping them with a big digital transformation. As part of that, before the organization jumped into the new HCM system and implementing that, right, there was a recognition that really across the system we needed to make sure that the job architecture was under control, and that there was alignment there. Really, there were a lot of differences from the corporate perspective and from the regional perspective. Again, the multiple regional hospitals had not been collaborating on similar structures, and so there was lots of differences in pay. Or the director at one organization was not, let alone not being paid the same as a director at another hospital within the same system, but also the responsibilities, the job expectations also were not aligned. The reason that we brought this one up in this sort of cost avoidance or cost shifting or cost savings presentation is that there were a lot of instances where there were jobs that had been created just to create a new title so that you could pay somebody more. And the responsibilities, the expectations, none of that was different. So there was, opportunity to really refine the structure. We left the organization with some decisions to make around how to handle the changes to the pay bands, the way they were set up in the future, right? We had a lot of folks that were over the pay band because they were not in a place that they should have been in initially. And so, when everything settles down and everything and the governance is followed, right, the organization will be in a good place going forward to have clear career paths, expectations, career mobility across the organization. But it's going to be a little while to get there, but it was really important part of the process, especially in light of the digital transformation happening, to make sure that there was that baseline set of expectations and alignment in order to have that future focus going forward. So a lot of goodness came out of this analysis as well.
I saw some head shakes in the crowd of acknowledging that it's a problem, right? And sometimes it's, we want this person, we believe that they're the most talented individual, but the job role that's open, it's not going to, it's all of the right skills, all of the right description, but it's not the right salary, so let's just change it a little bit. Right. And all of a sudden, your cost alignment, your ability to benchmark accordingly gets completely thrown out of whack. So, a great example of a cost avoidance that is going to take place. It's just you're playing a little bit of the long game.
Yeah, absolutely.
Wonderful. We've got one more that I thought was applicable here. So, this was a healthcare organization largely focused on growth through M&A, right? To buy and envelop other hospitals into their overall health system. For this particular organization, what they realized is they would continue to utilize a lot of the same benefit administrative practices, the use of FTE people time to get some of the work done, but keeping this FTE process over here and this over here and this over here, really not driving to a greater level of efficiency. And so this didn't require a lot of workforce outreach. This was simply one of those ones of help us understand how you're delivering this benefit, how you're delivering the value out to the organization. Help us understand how does the organization understand and internalize all of that value. And what quickly we learned was that the administrative processes were almost getting in the way. People were saying, this is the way that we've always done it, so we're going to continue to always do it. And what happened here was very different than here, very different than here, and here. And so one was, let's be better about this. Let's look at harmonization of both medical benefit administration, in this case pension. The pension plan across some of these organizations was still alive and well, but the processes that were in place to deliver that value to the organization required some enhancement. That included outsourcing, right? To think about the idea of sharing the cost of the administration, sharing the cost and the risk of that administration. I know for a long time people thought outsourcing more expensive. The reality of the situation is in each one of these instances where we have projects like this, if you look at it a 5, a 10-year horizon, from both a risk mitigation standpoint and enhanced service and cost, it largely is starting to get to a point where it's a wash, which is not something I think that we could have said 15 years ago, but advancement in technology from a benefits perspective, advancement in self-service has created an environment where for this client, it became a no-brainer. Automation and outsourcing.
Well, because the risk management is really important, right? Especially, we all know, right, benefits are extremely complicated to get right and administer, and the penalties can be, significant. So to use a vendor that this is their specialty in order to do it is so critical. But also just from the employee experience perspective, right? Some of the, as you mentioned, self-service, right? There's tools and automation and things that are just so easy to make available now that you can't necessarily do in-house. So we're seeing it being a really good option for
and in some of those cases, it's hard to retain the in-house talent, the team that looks and says, I want to plan my career around benefit administration. That talent pool is getting harder and harder to grow at younger stages of career, where salary bands are a little bit easier to take on. You're looking at folks who are in this marketplace 20, 30 years because it was a vibrant marketplace at one point, and they still have a very definable and unique skill set, but unfortunately that comes at a cost. So we're seeing those costs get a little neutral. I did want to point out the third bullet there, like governance structures to manage your third-party providers, to be looking at SLAs and KPIs in not a punitive way, but in a way that creates the experience that you're looking for the workforce, and the quality of that experience staying high. For this organization, what they kept realizing is that mistakes were made. Mistakes are costly. And so looked very carefully at, with continued outsourcing, how do you manage those vendors to always create the right experience? And then to the point that you were just making, right? Then communicating it all out, to letting the workforce know in a branded and succinct way, here's how we're providing value to you. Here's how we understand what it is that made you want to come work for us outside of the job, but the way that we take care of you. Here are the rewards that we offer. Here's the manner in which you utilize the rewards. Here's the manner in which your family can utilize the rewards. And doing so in a way that creates the unique experience. I always say that when you can get to that point, when you can get to that sweet spot, that the employee understands immediately that the thing that they're being told about is a benefit for their circumstances, whether they want to apply it. The value that happens there, the connection, the relationship, it gets to a point where if a competitor comes and offers greater salary, the employee laughs because they think salary is going to come and go, but some of these things that this organization does for me and for my family cannot be replaced by an additional $10,000 somewhere. So the communication element, it was a big part of this client's journey. It's frankly a big part of most clients' journey when you're trying to emphasize the value from a rewards perspective. From the impact, right? It freed up resources to be able to spend their time elsewhere. It allowed people to think about things more strategically and from a transaction perspective, creating a better experience for that workforce. Streamline employee experience, again, people knew the value and immediately acknowledged and recognized the value in the enhanced way that it was being delivered. So those are some of our use cases that we just wanted to show that there are ways when somebody comes and says, we need to find budget, total rewards is the largest spend, we need some way to trim it. it's a conversation, but there are ways that you can look at that budget, and there's ways that you can maximize that budget. There's ways that you can roll out new things from a very cost-effective, cost-neutral perspective. So encourage the group if you have any questions about what we've shared today. If you want to follow up with us offline, again, Naomi, myself, Annie will be here in the room, or again, if you want a little bit more private one-on-one, free 30, 45-minute consulting, we'll be in there and happy to spend some time together.
Awesome. Thank you, everybody. Appreciate the time.
Thank you.